करूं?
It's great. I'm mute or I'm.
No, you're not mute.
मिनिमाइज करूं पड़ता है या देखा था नहीं क्या पड़ता है हेलो
हेलो
हाँ Good evening, friends, ladies and gentlemen, Devi or Sajjano. Today I have been given a Herculean task of talking on COVID-19 and diabetes. It's a very vast subject. I'm not surprised that in future we will have what we are likely to have a cardiology branch or gynecologist branch. Similarly, we'll have a COVIDology branch definitely after 2-3 years if this COVID pandemic persists. So today we are planning to have or rather facing two pandemics. Number one pandemic which was already existing was diabetes, and the second pandemic which we are facing right now is COVID. So it's a deadly combination. COVID and diabetes, these two pandemics are a deadly combination, and most of the people who die in ICU or in hospital setup, they have these two combination. On top of that, if a person is above 60 and he has another comorbidity like blood pressure or heart disease or kidney disease or lung disease, they vanish very fast because it has an added effect, and COVID finally pushes them to a final death. So, friends, mankind exists, as you all know, minimum for last 5,000 years, and modern medicine it exists for last roughly 200 years. Now, in this 5,000 years, if you see without modern medicine, we have defied and survived many pandemics, many tsunamis, many wars, and many natural calamities. So, in life, what I say is only certainty is uncertainty. And this is evident by this particular, how do you go ahead? Yeah. So, friends, it's a mad world. The picture which had come about 75 years back, and this signifies the whole ideology of mad world, because if a patient has a headache or cough or cold and he goes to 10 doctors, he gets 10 different prescriptions. Probably that must have prompted the producer and director of the movie Mad World. So finally, how can I'm not able to progress. So two things are infinite. The one thing is universe, that is for sure. That is what as Einstein has said. And the second thing is universe. So Einstein was not sure about the human stupidity. He was confirmed, or he was rather calculative about the universe and the positivity about universe, which was indefinite. But human stupidity, probably he was not very much sure. Next, you change. So this is a human. This particular cartoon shows human stupidity. This is a fitness center. People are not using escalator, but they are using a staircase to go to the fitness center. There is no lesser example which you can give about human stupidity. So what is the present status of COVID? The present status is absolute chaotic disaster. You can see this situation. It's absolute disaster. You do not know which wire is going where, which car is going where, and how it will turn. You do not know. So finally, the whole ideology is this actually represents today's COVID position. So I describe this situation of medical professional today, or in general, or all of us, that we, led by the unknown, have done so much doing impossible for so long, so little. We are now qualified to do anything with nothing. Minimize them. Okay. So as this is a very favorite statement of mine, that medicine is art, science, and commerce, but it is never a maths. So this is an art of medicine. Now you do not have, you are in a village, small village, and you want to find out whether you are having COVID or not, or you're suffering from this disaster. This is cartoon, but it's very true that husband and wife, if they quarrel for 10 minutes, and after 10 minutes, if they don't get breathless, probably they are not having COVID. So that was an art, and this is a science of COVID, science of medicine rather. That first week, which is very important, that in the first week the person is normal, he gets temperature, he doesn't have any other symptom. But after first week, the viremia goes down. That means the infection goes down, but the patient becomes serious. So one has to understand that the seriousness of the situation increases after first week of COVID fever. So that sometimes what happens, if you are having feverless, if you are having asymptomatic, after 1 week, you take it so lightly, especially a person who is old, that he or she probably is, going around and probably gets breathless and needs ICU admission. So one has to be very careful throughout those 15 days. After 15 days, if supposing a person is younger and let's say less than 60 and has no other comorbidity like diabetes and blood pressure and lung or heart diseases, probably he can mix up with the family members, and probably the infectivity becomes less and he cannot infect the other members of family or the society. So this is again a science of medicine, that if supposing someone is running, okay, jogging with mask on, he has more chances of burst lung, which many people they do not understand. Actually, they just collapse on the way after a kilometer or so, and they are not supposed to jog. They are not supposed to run. They are not going to be on treadmill for a longer time, because otherwise it will damage their lung more. So they are trying to protect themselves with mask, but at the same time, it's more dangerous to run on treadmill or on the road or on the beach, because they can have a disaster. Yeah, and this is a commerce of medicine. So people are taking advantage of this particular disaster and trying to make fortune out of it. So you must not have seen this kind of a mask, but it will come in the future if this COVID issue persists for a long time. And there is a lot of confusion with WhatsApp, universities, the TV and print media, the changing guidelines of corporation, daily something new coming up, and a doctor is really confused because the he advises something today and there are certain different guidelines, and it becomes a real complicated issue. It's very difficult to explain people. It's very difficult to make them understand. As this guy, he's helplessly watching people moving around, and he has got nothing else to do but to be a silent observer. So there is a lot of confusion in the mind of people which way to go, whether to follow WhatsApp universities, whether to follow poor doctor, or whether to follow Facebook. So another example of a commercial exploitation, which has become very common in these days, is through advertisement. We get varieties of immune boosters, we get home remedies, Ayurvedic, homeopathic, and Unani medicines. Sometimes these people or this particular medicine, they cause more harm than help. Why? Because when you use this kind of medicine, you do not know whether your kidneys are normal or functioning, whether your livers are normal and functioning optimally, and if they are not, then this particular medicine along with modern medicine can cause a real problem and hasten your ICU admission. So this is the guy, and because there are lots of people, especially godmen, they come in the picture. This guy in from Cameroon, he was trying to heal people by his hand, what we call it as Ashirvad, and he was saying that by prayers you'll get all right. But he himself died with corona. So the life is created. This life, how life is important. That's what I wanted. This machine, the human body cannot be manufactured. Even the best of the best instruments available on the earth, whereas this particular two cells, sperm and ovum, they can make a body of over 100 trillion cells. So, the body facts, what I want to stress is that when you are born, God has given you $100 billion as a gift, because in the whole life we have 4 billion pulses in the sense beats, heartbeats. So our heart beats 4 billion times in our lifespan during the whole lifespan of, say, for example, 70, 80, or 90 years. And if you can count $25, which was put arbitrarily by one of the US doctor. So $25 per pulse or pulse per bit, if you count, it becomes $100 billion. You could be richer. God has given you much, much more than even Bill Gates. So understand that God has given this kind of gift to you, and utilize this gift properly, and don't waste your body because your God given gift. Because if you do try and do that kind of a thing, what is happening is we have annual maintenance of car, annual maintenance of your laptop, even mobile. Okay, we preserve so nicely, but we do not preserve. We start gulping any Tom, Dick, and Harry, suggesting some kind of medications to you, and without realizing, you actually are gulping it down. And there are lots of complications which can occur, like a person who complains of itching of throat. He has no COVID, but he's probably gargling with some strong stimulus, and which he has read or seen on WhatsApp, and probably that is the cause of itching, or that is the cause of cough, and that is the cause of probably an acidity or something, and people, they'll end up in a hospital in the middle of the night. So government of Cameroon, they passed a law, and they said that anyone who claimed that they have got COVID-19 treatment, he actually is infected with that virus, and he was told, or rather he's told, to try the same medications on himself, and if he gets all right, probably the medication is success. But most of the time that is not the case. So what is the Hippocrates? Hippocrates was the first doctor, and this particular doctor in 2000 BC, he said that primum non nocere. He was a Greek person. Primum non nocere means first do not harm. The first principle in medicine is if you cannot help the person, you should not harm him by your treatment. So my humble suggestions to these people is that check the authenticity of the medicine, or probably whatever compound they are gulping or taking. Use natural products and not the synthetic products. Do not combine many therapies like you do. Some people, they take kada, which consists of so many ingredients, and this can become dangerous because chemicals can react with each other, and these many people, they have no idea. So everyone says that we have come alone and we are going to go alone, but actually speaking, that is not the fact. So this is the maths of medicine, that what we believe is wrong. No one comes without two people, and no one goes without four people. So this is the actual maths, but we have a wrong maths, and we say that we have come alone, we go alone. So now let's come to the diabetes point of view. We have talked enough about COVID. The diabetes point of view is those who have got diabetes, they are more vulnerable with COVID. That means if I have a diabetes, I've got more chances to visit ICU than you people who are not having diabetes. Moreover, if supposing some person has no diabetes, they say we have no diabetes, but it gets precipitated. That means someone's blood sugar is 100 or 120, and when they suffer from COVID, the sugar goes shots up to 200 or 250. So this is the actual situation where many people, they come to the hospital, they tell us that we do not have diabetes, but their blood sugar shows quite high values. So diabetics are special subgroups, and they need special precaution with COVID-19 infection. That's a fact. And COVID becomes more serious in diabetes. That means if you have a diabetes, supposing your sugars are normally remaining around 200, when you have a diabetes, the sugars are represented as 200, 250, 300. On top of that, the medications which are given in ICU or hospital setup are, adding up the sugar levels, and you require actually insulin. Moreover, it increases diabetes, increases the chances of cytokine storm. What is cytokine storm? Is the final analysis. That means a person, there are a group of people who can have this cytokine storm. That means that fever is gone, the cough is gone, but after 1 week they are about to discharge, and suddenly the body reacts in a very different way. That means supposing a person is fighting and someone has stabbed him, and the person who has stabbed him goes away, but the person who is stabbed is reacting in a very funny way. He starts shouting, doing all sorts of things, and that's actually happens in the body, and that's called cytokine storm, which actually is more dangerous, because a person who is stabbed has to sleep down, has to rest, but supposing he starts moving around, running around, probably uh, it's more dangerous for him. And then when you do that, the multi-organ failure develops, and the person probably goes into a very severe situation. So the whole idea is, when you are suffering from COVID, you are in hospital, you must stop oral hypoglycemia. That means your oral drugs, but you are taking for diabetes control, and start insulin, preferably short acting. If you are on insulin, continue under the supervision of a physician. Don't try insulin on your own or by through someone who is your friend. The dose may increase depending upon medications given. If you are given steroids, the dose of insulin will increase. Once the treatment of COVID discontinued, then naturally the tablet which you are taking can be restored slowly over a period of time. And please do not self-treat or adjust, which is, I'm underlying that particular statement. So monitor your oxygen saturation and blood sugars frequently, refrain from home remedies, get admitted at first sign of hypoxia, follow your physician's advice. So diabetic population may require antiviral drugs, control that viremia, that means the virus is inside. So you will have to kill that virus with antiviral drugs which are available. Your doctor will give you an appropriate medication like favipiravir or remdesivir. And if your age is more than 60 and your oxygen saturation, hypoxia is oxygen saturation which is less than 95 or probably drops down below 90, and there is a continuous fever, you have to be very, very vigilant. Don't try to, or don't remain at home. You will have to be admitted, preferably in ICU, and get yourself treated by an expert doctor. So resume your diet once you're all right. Once you come home, you can resume your diet, you can do your exercises, and pre-COVID anti-diabetic therapy can be resumed. This is a very complicated slide, but only thing which I want to tell you, that if you can control your diabetes very well, then probably your person's chance of dying is less than 87%. That means if your diabetes is controlled very well, probably you will not get serious, in short. So this is the Dr. Saul from United States of America. He's from California. He said in his lecture that 1/4 of what you eat keeps you alive, and 3/4 of what you eat keeps your doctors alive. So probably you want to remain alive. So try and control diet by 1/4 of your normal diet. This is what he meant. So finally, there are two terminologies which are evolving. They are COVIDitis and COVIDophobia, like we have got appendicitis. Since COVIDitis is something where it is not COVID, but it is the COVID in the brain. So probably now at this particular juncture, the hospital, they are flooded with COVID. 1 year back at this particular time in last August, there was nothing like COVID admission. But today, practically 90% of the hospital admissions are COVID. So there is no disease which is existing except COVID as of now if you go to the hospital. And there is myths about smoking. There are people who, I'm on a helpline, and there are people, they ask me, can I smoke? Can I smoke more? I said, why? Then they tell me that because the coronavirus gets dead due to heat, so we must smoke more. That's a myth, but somehow this myth is going on, and people have got all sorts of funny idea. There is an obsessiveness about the alcohol, because people think that alcohol kills the coronavirus, so we should take more alcohol. Again, that's a myth. That can damage your liver. Smoking can damage your lung, and you can go into cytokine storm if you have got diabetes and if you are above the age of 60. Then there are chest pain and breathlessness. Now, this chest pain and breathlessness, when a patient complains, there are lots of people who complain. 10 out of 9, 9 out of 10, they do not have COVID. They just have psychological issues. and probably before putting them or before diagnosing them as COVID, you must rule out the psychological problems on patients who are complaining of chest pain and breathlessness. So there is a fever and throat irritation. So then, as of today, any person who has got fever and throat irritation, they immediately rush to the hospital or rush for COVID test, thinking that it's a COVID. But thyroiditis, a special disease, can cause fever and throat irritation, which many people, many even physicians, many even doctors, they are not aware, or probably even if they are aware, as of today, they go and try and do treatment for COVID. So there is something like COVIDophobia. This is a COVIDophobia. So some people, they ask me whether can I put hair dryer in the nose. I said why? Because they say that hair dryer can extract all the viruses from the nose. There is a vacuum cleaner in the mouth. Some people, they ask me because I said why. Then they say that particular vacuum cleaner can draw out all the virus. But these are all wrong things. They can damage your mucosa. They can damage severely. Don't never try to do this kind of a thing. There are people, even they want to gargle with soap because they say that when the virus is there on the surface or on the hands, by washing your hands with soap for 20 seconds, the virus disappears. So they want to gargle with soap water, other detergents or whatever. But again, it could be very dangerous. Then there is an increase in insomnia, that means sleeplessness. People, they do not sleep properly because of anxiety and depression. And there are increase in OCD cases. There are number of people, they come and they complain of washing their hands frequently. um, this is a part of OCD, that is called obsessive compulsive disorders. They keep on doing the same thing again and again. So smoking, my dear friends, I'm coming to an end. This smoking in this particular situation of COVID, drinking in this particular situation of COVID, then stress, then anger, depression, sedentary lifestyle, junk food will cause all of these 5, 6 items which I've shown you will cause diabetes, will cause blood pressure, will cause increase the cholesterol level, and finally together it will give you a heart attack or stroke. So friends, Jack Ma has said that if you are alive, don't worry about your economic level as of today, because if you are alive by 2020, that is the thing which you earn, actually, that you consider that as a profit. So love your family, love your children, love your surroundings, and see the positive effects of Corona. Try and appreciate this, that pollution is minimum. People have started enjoying nature in this Corona time. Family bonding has increased. Feeling of empathy and sympathy has developed. Aggression is decreased. So many advantages. Life has become easier. So life, we have understood that lifestyle is costlier, but not the life itself. So this is my way of meditation. I usually, you must meditate to come over all these psychological symptoms. And my way of what I propose is that you have to deep in meditation. Baba Ramdev will tell you that inhale and exhale. Okay, but I tell you this particular modified way of meditation, medical meditation rather, that exhale past without regrets, hold the present with happiness, and inhale the future without expectation. This is my suggestion to you people, and you can remain healthy when you do this kind of meditation. So be positive. On a small uh, joke, I would end that a reporter is asking to a 99 years old man, hope to see you next year, and the old man replies, why not, you still look healthy. So that is the positivity which I would love all people to accept and adopt. So this is the final thing where we are the game of life we are playing. Again, it's like a chase which we are playing against God. Whatever you do, me do, we control diabetes, we control blood pressure, we control all the chronic disorders, but age you can never control. And finally, the game of chess which we are playing against God, we have to lose, and we will lose one fine day. So I'll end now, and I'll say that हर मर्ज का इलाज नहीं दवाखाने में, कुछ दर्द चले जाते हैं सिर्फ मुस्कुराने में. Thank you very much, friends, for your patience is listening. Thank you. Yeah, unmute. If there are any questions, I would love to answer them.
Sir, there is lot of talk about coronal and coming up. So how effective is coronal?
See, I will tell you that there are no double-blind trials. If at all you have to have any medications, you will have to have blind trials. And if these blind trials are there, then only. So, for example, there are lots of allopathic medication for which we do not have even as of today a trial or proper trial rather. So, all these things, as I said, is a commerce of their commercialization of corona, nothing else. Anything?
Sir, hello, sir.
Yeah.
Hello.
Yes, yes, I can hear you.
Uh, Sir, I am Amit Upadhyay.
Yeah. Bolo Amit bhai.
Sir, how is the working, sir, Flu? And can we take, sir, Flu in initial
Flu
stage,
is
sir?
a very good antiviral drug, but you cannot self-medicate. You should take
Okay,
it
okay.
under the supervision of a doctor.
Okay, sir. Okay, sir. Thank you so much, sir.
Thank you. Time up. Anything else? I
Sir,
would
how
like to
can we
tell
reach
all of
out to
you.
you for consultation? How do we reach out to you if we want to consult you uh, to control diabetes and for anything?
You can do one thing. There is an app which is available on Docon. Docon app which is available on which Play Store on your mobile. So you can download that and then you can come to me. We can have a video consultation on that app. First of all, you must all remember that medicine is not as simple as it looks like. Only thing is that if there are say for example, I was talking to someone and he said I have chest pain and I've got breathlessness and all these things. So I was little worked up and I said fine, you can't just take some medication but you come online. Then we had a video chat and then I found out that probably the chest pain and then the gabrat what he said or anxiety whatever was there was simple psychological. It had no basis for any complicated issues. But these people, when they suddenly reach the hospital, probably they are in ICU and probably they can be, returning home within 1 or 2 days, of course, with psychological level, but they probably can get COVID when they are in hospital atmosphere. So one has to be very, very careful. Don't just run and for small symptoms to the hospital because hospitals are probably having more of COVID patients, more of issues with this particular infection. Even the staff and even the ward boys and ayas probably could be a asymptomatic carrier. So you have to be very careful before you go to a hospital. Think twice, and if it is you feel that it is very serious, and your doctor says no, you have to go to the hospital. Yeah.
Sir, may I?
Yes.
Sir, can you just give us some small tips to control diabetes at home? Because
Diabetes.
with the medicine,
No. With
with the
medicine.
medicine, it's what we control it already.
Yeah.
But still a little bit tips for the things that we can do it at our home
Whatever you
because we
are
cannot
eating,
go for a walk or somewhat.
you of
Yeah,
course you
sorry
should
to
walk.
disturb you.
You must walk 15 minutes 3 times a day. Approximately 1 hour walk is what is required as far as if you are diabetic. Even otherwise also, if you don't want to get diabetes, you walk for 1 hour. That's the minimum. Especially after the age of 45, 50, you must walk because the
Okay.
excess burning of the sugar. Say for example,
Okay.
if you have a nala, okay, it gets dried
Okay.
up in the summer because there is a lot of heat and probably it can form a stone and mud and all whatever. The same thing is that we have a pipeline there like nalas, smaller and bigger, and if you keep on walking, okay, the blood circulates fast because of rain. The nala gets washed away. The water washes away all the mud. Similar thing happens in the body. If you are staying calm, if you are just sitting down, if you are not doing anything, not becoming active, probably the cholesterol in the blood can get deposited in the interior, and then it's like nala which is getting choked up. So here also, any flowing water will not choke up the pipeline. The same principle applies here, that whenever there is a blood flow which is continuous, then probably there is no choking. So the whole idea is to remain active, whether you are old or young. Preferably when you are old, you must do this kind of a thing, this kind of an exercise. And it has to be a continuous process, because if you are stationary for a month or so, then probably some 10 to 20% arteries can get blocked. And this block, once it is blocked, probably it is forever. So that you must try and understand. That's why many people, they go for angiography 50, 60 years, probably they have about 40-50% block. And on top of that, if you are again having a sedentary lifestyle, the blocks will keep on increasing and narrowing the vessel, and then the blood supply to the organ will be less. And that's how and on top of that, if you get this COVID infection, probably it's the last straw on the camel, and the person probably becomes very serious. The oxygen saturation goes down. There is a multi-organ affection, and if not treated in time, there would be a multi-organ failure. So that's how the end comes. But forget about COVID or no COVID, you must try and see that you have to walk for 45 minutes a day, and just cut down your carbohydrate. I always say that it is SOS, that means salt, oil, sugar. Cut down salt, oil, sugar in your diet. If you cut down salt, you decrease your blood pressure. If you cut down your sugar, you decrease your diabetes. And if you cut down your oil, you control your cholesterol. If these three things are controlled, and if you keep on walking, probably you will never, your arteries will never get clogged. On top of that, there is another triad which you must remember is SAS. That means smoking, alcohol, which are controllable things, but many people, they do not understand. They continue it, and they add up to this particular struggle of clotting the arteries. And if supposing a person is smoking, a person is having alcohol, on top of that he has got stress, then stress, alcohol, smoking, diabetes, blood pressure, cholesterol, all these 6-7 things probably kill a person faster.
Thank you very much, sir.
Thank you. Stress is an important predictor. So try and distress yourself as much as possible. Because stress can increase diabetes, stress can increase blood pressure, stress can increase cholesterol.
Thank you very much, sir.
Thank you. Right, so we end our session today. We'll see you in future, all of you. I'm really thankful to all of you for your patient listening and real good questions.
So one more thing.
Yes.
So one more thing.
Yes.
So could you just share your number on the chat if you don't mind?
Number on chat. How do I check?
On the chat box.
Yeah.
Yeah, thanks a lot, sir. We got it. Yeah, we got it, sir.
Down. Yeah, I'll
Thanks a
send
lot.
you. Okay. Thank you, all of you.
Thank you, sir.
Thank you.